Bismillahirrahmanirrahim. So today we are going to study about the bloody diarrhea. The bloody diarrhea. In the previous lecture we have already discussed about the diarrhea, the watery diarrhea, and its causes. The main cause is the enterotoxigenic strain of Escherichia coli. Some epidemiological or important points regarding the Escherichia coli and their characteristics. In this lecture we will study about the bloody diarrhea. So this bloody diarrhea, it is mainly caused by two strains of Escherichia coli. The first one is the enteroinvasive strain of Escherichia coli, which is also known as enteropathic strain of Escherichia coli, and the second one is the enteroheamorrhagic strain of Escherichia coli. This enteroheamorrhagic strain of Escherichia coli, the main reservoir of this enteroheamorrhagic strain is the cattle, as we have already discussed in the epidemiology of Escherichia coli. First, talking about the enteroinvasive strain of Escherichia coli, that how does it causes the bloody diarrhea. Enteroinvasive strain of Escherichia coli. So first of all, it adheres to the epithelium of the colon. For example, this is the colon, this is the epithelium of the colon. It adheres to it, and after adherence it invades this epithelium. It invaded and causes inflammation. This inflammation will in turn produce the cytokines and other infiltrations of the nuclear of the leukocytes. This cytokine and infiltration of the leukocytes will in turn damage the blood vessels in the colon and also will cause death of these epithelial cells, and thus will produce the bloody diarrhea. Due to the excavation of the blood from these damaged blood vessels. So it is the pathogenesis behind the bloody diarrhea produced by the enteroinvasive strain of Escherichia coli. Now what will be the clinical findings? So the main clinical finding will be dysentery. And this dysentery, what is dysentery? It is the same bloody diarrhea, visible blood in the stools. There will be also inflammatory cells in the stool on microscopic examination. Inflammatory cells in the stool if the stool is examined on the microscopy. Now the second strain of Escherichia coli, which is the enteroheamorrhagic strain of Escherichia coli, and it is also known as a Shiga toxin producing strain of Escherichia coli because it produces a toxin known as Shiga toxin. It also causes the bloody diarrhea. Now how does this enteroheamorrhagic strain of Escherichia coli causes the bloody diarrhea? Toxin which is known as Shiga toxin, also known as virotoxin. What does this Shiga toxin do? This Shiga toxin, they remove the adenine from the 28 Swerberg subunit of the ribosomal RNA or the ribosomes, and thus inhibit the protein synthesis. And these proteins are the essential components, essential for the survival and growth of the epithelial cells which surround the gut. gut epithelial cell. So if these proteins are not present, the gut epithelium will die, and this death of the epithelial cells will result in the excavation of the blood from the blood vessels, and this will produce the bloody diarrhea. So it is the mechanism by which this sugar toxin or the virotoxin produce the bloody diarrhea. Now the important point is that this sugar toxin is mainly encoded by lysogenic bacteriophage. So it is the extra important point which can be important for the MCQs, both USMLE and the internal exam. The sugar toxin is encoded by the lysogenic bacteriophage. Now, what will be the complications of this enterohemorrhagic strain of Escherichia coli causing the bloody diarrhea? Now, if this sugar toxin it has not invaded in the production of bloody diarrhea, the sugar toxin does not invade the mucosa of the gut. It only do what? It only remove the adenine from the 28S subunit of the ribosome, and thus prevent the protein synthesis in the epithelial cells. But it's in complication if this sugar toxin enter the blood vessels, i.e. sepsis occur. And what will it do? It can cause one of the most important syndrome, and that syndrome is known as hemolytic uremic syndrome. Hemolytic in the sense that this syndrome is characterized by three symptoms. The first one is the hemolytic anemia. So thus hemolytic. The second one is the acute rheumatic fever. And thus in acute rheumatic fever, what occur? There is increase in the urea concentration in the blood, and thus uremic. And number 3 is the thrombocytopenia. How does this thrombocytopenia occur? How does this hemolytic anemia and the acute renal failure occur? We will discuss in the pathogenesis. So let's talk about the mechanism of action and how the sugar toxin produce the hemolytic uremic syndrome if it enters the blood. So the first step, remember that the blood vessels, endothelium and epithelium present in the kidney. Consist of receptors for this sugar toxin. Now if this sugar toxin enter the blood or the blood vessels, it will cause damage to this endothelium. As well as to epithelium of the kidney. And if this damage occurs, this epithelium will be damaged, and it can result in the acute renal failure. So it is one mechanism by which the sugar toxin can produce acute renal failure. How does it cause the hemolytic anemia and thrombocytopenia? When this sugar toxin damage the endothelium, what will be occurs? When the red blood cells passes through this damaged blood vessels whose endothelium has been damaged by the sugar toxin, there will be the morphological distortion of this RBC, and there will be production of the cytocyte from this RBC cytocyte. And when this cytocyte passes through the damaged blood vessels, it will rupture because their membrane is so easily breakable that it will cause rupture of this cytocyte produced from the RBC, and this will increase, and this will cause the hemolytic anemia. Also, when this endothelium is damaged, the platelets will adhere to this endothelium, and there will be decrease in the platelet concentration in the blood, and this will result in the thrombocytopenia. Thrombocytopenia. Also, when the RBCs are broken down, there will be release of a lot of heme. And when this heme enters the kidney, it will cause damage to the kidney. And this damage to the kidney can also result in the acute renal failure caused by the Shiga toxin. So it is the second mechanism. The first one is the damage to the epithelium directly by the Shiga toxin, and the second one is the increased production of the heme, which will cause the damage to the kidney and thus the acute rheumatic fever. So this was some point regarding the bloody diarrhea and the hemolytic uremic syndrome. We will study about the urogenital signs and symptoms caused by the urinary. We will study about the urinary tract infection caused by the Escherichia coli in the next lecture. So kindly stay tuned. That's all about today. Thank you. Also keep in mind that the ciprofloxacin, which is a drug belonging to the quinones group of antibiotic, this is contraindicated in the treatment of hemolytic uremic syndrome. And why it is contraindicated? Because this ciprofloxacin will increase the breakdown or death of the bacteria, and this will in turn increase the production of Shiga toxin, which will in turn increase the incidence of hemolytic uremic syndrome or other complications of the enteroheamorrhagic strain of Escherichia coli. So that's all for today. Thank you.